Hi everyone, welcome back to my channel where we take big ideas like medical trauma and PTSD and break them down for both professionals and people who've experienced it. What are the symptoms of PTSD following medical trauma? We might see pervasive or intrusive thoughts about the memories or the aspects of the medical trauma event. So you might find yourself sitting there and you can't stop thinking about, your brain just won't stop shoving in memories, thoughts related to what happened to you. So maybe replaying the memory of getting the diagnosis, replaying the memory of waking up from surgery. That's me. Next one, you might experience significant distress when you're confronted with reminders of the medical trauma. So big time on medical appointments. If you have to go back to the place where you were traumatized previously, obviously that's going to be a trigger. Sometimes we can even pick up some unusual stressors. Like for me, the smell of rubbing alcohol really just started the trigger of the fear cascade in my brain. So another one is disruptions in treatment adherence due to trauma-related avoidance. So what that really means is medical avoidance, and this is a big one in the medical trauma community. And that means that we are going to avoid going to the doctor at all costs. We're going to avoid medical treatment at all costs because we're so afraid of what's going to happen to us. I'm afraid that I'll show up to the doctor's office and they're going to hospitalize me. They're going to keep me for some reason because something really is wrong. If I can just avoid going to the doctor, perhaps that means that it'll go away or that nothing is wrong with me. I know that sounds ridiculous, but it is a real thought process in people who have survived medical trauma because we don't want to go back to where that trauma occurred again, no matter what, even if our health is potentially at risk. Another issue is maybe overutilization of healthcare, really overchecking health-related behaviors. Any little pinch, zip, cramp feeling in our body is going to cause extreme anxiety and maybe sending a message to our doctor in the middle of the night saying, that's it, I'm dying. What are we going to do about it? Now, you might be wondering, how common is PTSD after a medical trauma event? So most people who experience a traumatic event do not go on to develop PTSD. It's common and expected for people to have some difficult reactions the days and weeks following a medical trauma. I don't think anyone gets a cancer diagnosis and is fine about it, just completely goes on with their day unchanged. But it's estimated that approximately 1/3 of traumatically injured patients experience PTSD or depression symptoms following the injury. So knowing that, we really should have better measures in place to screen, treat, refer, follow up. But unfortunately, this is a newer concept and people are just starting to understand what medical trauma is, how to treat it, how to prevent it, etc. If you have any questions, please let me know. Leave them below. I love answering questions about medical trauma, and I'm really looking forward to this journey with you where we explore and grow this community and learn more and more about medical trauma together. Thank you so much. I'm Dr. Krisy Elrod. Goodbye.